20 seconds of hand hygiene. So my patient and I, we both have our mask on. I want to mention my supplies for today. I have a Foley catheter kit, alcohol wipes, 10 ml sterile syringe, stabilization device, personal wipes, chucks, clean gloves, and sterile gloves. Hi, my name is Nancy. I'll be your student nurse for today. Can I please have your full name and date of birth while I check your wristband?
Tina Fey, May 18th, 1970.
Perfect. Matches your wristband. Miss Fey, do you have any allergies?
No allergies.
And are you in any pain today?
No pain.
Okay, so per the doctor's order, I'll be inserting a Foley catheter for you today. It is a thin tube that goes into your urethra and into the bladder. This will help the urine be released more easily and give you some relief. But before I insert the catheter, I will clean your perineal area with some cleaning wipes and iodine. We will insert the catheter and then inflate the balloon, which will hold it in place. After that, I will collect a urine sample and send it to the lab. Finally, we'll secure the catheter to the outer thigh, your outer thigh, and with a stabilization device. Do you have any questions or concern about today's procedure?
No.
Okay, sounds good. And have you done this before?
Yep.
Perfect. Okay, so I'm going to close this privacy screen. I'm going to prep my work area. 20 seconds of hand hygiene. I'm going to clean the surface area for 30 seconds. And make sure I get the edges of the table as well. Okay. I'm gonna let this dry for 2 minutes. Okay, hand hygiene 20 seconds. Ms. Faye, is it okay if I pull down your blanket and lift up your gown? I'll be cleaning the perineal area now.
Yeah, go ahead.
Perfect, thank you. Okay, so before we start, I'm gonna put you in a supine position, and I'm gonna have your knees bent and then their legs spread apart like a frog-like position, okay? And I wanna mention that they're chucked in place already. So let me help you with your legs. Okay. Perfect. Okay, move gloves. Hand hygiene 20 seconds, put on new gloves. Okay, I have my personal wipes here. Okay, Miss Faye, I'm going to clean the perineal area now, okay?
Okay.
Okay, spread the labia. First wipe right down the middle, front to back. Second wipe, outer labia, front to back. Third wipe, front to back. Okay, I'll covering you up again. Remove gloves. 20 seconds of hand hygiene. A new glove. So my table has dried for 2 minutes now. I'm going to transfer my supplies over. Miss Faye, I'm going to need to lift up your gown again. Is that okay?
Yeah, that's okay.
Perfect, thank you. Wait for me. Okay, 1 inch forward. Go around 1 inch border. Perfect. I'm going to remove my sterile gloves for later. And put on the drape for my patient. 1 inch border. Shiny side down. Perfect. Now I'm going to drop in my supplies. First, I'm going to drop in my sterile syringe. Perfect. Dropping in my stat lock. Perfect. And lastly, dropping in my CHG pad. Perfect. Remove my gloves. 20 seconds of hand hygiene. I'm going to be putting on my sterile gloves now. Fix my, uncuff this. Okay, now I have my sterile gloves on. I'll be removing this box. Removing my stuff to the side. Okay, Miss Faye, I'm going to clean the perineal area again, but this time with iodine, okay? You
Okay.
ready?
Yep.
Thanks. First one, front to back, right in the middle. Second, first, front to back, outer labia. And front to back. Okay, Miss Faye, so I'm going to insert the catheter now. So you're gonna take a deep breath and hold it. And on a count of 3, I'm going to have to exhale, okay?
Okay.
So 1, 2, 3, exhale. Okay, good. I see urine coming out. So let me advance it 1 more inch. Go ahead and inflate the balloon now with 10 cc of sterile water. Perfect. Gently tug to make sure that there is resistance. I'm going to gently pull back on the catheter until the resistance met to make sure that the is secured in place. And there's resistance. Perfect. So now I'm going to cover you up. Remove my sterile gloves. Placing hand hygiene. My new gloves. Are you in any pain, Miss Faye?
No pain.
Okay, good. Any questions for me?
Nope.
Okay, so I'm going to collect urine sample now, okay? Get my CHG swab. Going scrub the hub for 5 seconds. 1, 2, 3, 4, 5. I'll be withdrawing 6 ml of urine. I see urine return here, so there's no need to kink the tubing. Okay. In hygiene 20 seconds, put on new gloves. I'll be putting the urine in the urine container. Okay, so I'll be labeling the specimen cup with the patient's name, medical record number, date and time of collection. I'm going to send this to the lab. 6 hand hygiene. Gloves. Are you doing okay, Miss Faye?
Good.
Doing a great job. We're almost done. Okay. Okay, I'm gonna help you move your legs back, okay? Okay, I'm verbalizing that I changed the chuck, so we're good. So now I'm going to use the skin protectant pad. We're basically securing the catheter with the stat lock. So first I'll put the skin protectant on first. Okay, so I'm going to use the secured clips to clip the extra tubing down. I'm going to attach the bag to the bed frame and make sure that the bag is below the patient's bladder. Okay. Okay, so let me clean up my area. Hygiene. I'm gonna cover you up with your blanket, okay? Hey, how are you doing, Miss Faye?
I'm okay.
Good. Any pain?
No pain.
Do you have any questions or concern for me?
No questions.
Okay, so at this time I'm going, I had already sent your urine to the lab, and I'm gonna put the bed in the lowest position, 2 to 3 side rails up, call light within reach. I'll scan the room, everything looks good. If you have no questions, I'll see you later, okay? So I'll go ahead and document my procedure, date and time of the procedure, how the patient tolerated the procedure. Miss Faye did great with no pain. Size of the catheter is 14. The description of the pain, the description of the urine is clear yellow with no sediments. Thanks. 20 seconds of hand hygiene. Hi, my name is Nancy. I'll be your student nurse for today. Can you please state your full name and date of birth while I check your wristband?
Tina Faye, May 18th, 1970.
Okay, I'm checking your wristband. Everything matches. Perfect. Miss Faye, do you have any allergies or are you in any pain right now?
No pain.
And no allergies?
No allergies.
Okay, perfect. So the doctor ordered for you to have your Foley catheter removed today. I will deflate the balloon using a syringe to extract all the water that's keeping the catheter balloon in place. I will tell you to take a deep breath and and blow out while I remove your catheter. It'll be super quick, okay?
Okay.
Okay, and have you done this before?
Yep.
Perfect. And do you have any questions, concern about today's procedure?
No questions.
Okay, sounds good. So let me close this privacy screen for you. And I'm gonna do hand hygiene for 20 seconds, put on gloves. And gather my supply. I have my chucks and my 10 ml syringe. Miss Faye, is it okay if I pull down your blanket and lift up your gown?
Yeah, go ahead.
Okay, thank you. Okay, so before we start, I'm going to position you in a supine position. Your knees will be bent and legs spread, sort of like a frog-like position. So let me help you with that. Okay, I'm gonna remove my gloves. Do 20 seconds of hand hygiene. New gloves. And bring over my chuck and my syringe. Are you doing okay, Miss Faye?
Yep.
Any pain?
No pain.
Okay, I'm gonna get started now. So I'm gonna remove water from the catheter balloon using the syringe. Okay, I was able to remove all 10 ml of water to deflate the balloon. If I wasn't able to remove all that 10 ml of water out of the balloon, I'll actually try again. Miss Faye, so this is the part where you take a deep breath and blow out. Are you ready?
Yep.
Okay, now take a deep breath and blow out. Perfect. Great. So the hard part is all done. Everything went smoothly. You did great. If there was any resistance, if there was resistance, I would actually stop and try one more time. If it didn't work the second time, I would actually leave it in and call the provider. How are you feeling?
I'm feeling good.
Good. Any pain?
No pain.
Okay, so I went ahead and put down new chucks. Let me help you with your legs. Let's move it back. Okay, cover you back up. Let me go ahead and get to clean this area up. I'm going to bring your catheter and the bag into the bathroom to measure the amount of urine. I'll be right back. Seconds hand hygiene on gloves. So I went ahead and measured your urine. You had about 300 ml of urine. I disposed of the Foley, and we're going to monitor your next 1 to 2 voids to make sure that you're able to urinate. There's possible stinging and burning after the first void, but it should lessen with each subsequent voiding. Please let the nurse know if you have unable to urinate, have increased pain, or any bleeding with urination, okay?
Okay.
Okay, so let me cover you back up with your blanket. Do you have any questions for me?
No questions.
Any pain?
No pain.
Okay, so at this time I'm going to lower your bed to the lowest position, 2 to 3 side rails up, call light within reach. I'm going to do some documentation. I'll see you later, okay?
Okay, thank you.
Okay. Move left, 20 seconds of hand hygiene. So for my documentation, I will document the time and date, the patient's tolerance of the procedure. Ms. Faye did great. There was 300 ml of urine. It was yellow and clear with no sediments observed in the Foley bag, and we will observe her next 2 voids. Thank you.